In this video, we are going to review the July 2024 Southern Nevada Health District Protocol Update. In July 2024, the Southern Nevada Health District updated its EMS protocols. The first update is in reference to the drowning protocols. Both the adult and pediatric drowning protocols have been removed. Providers should use the appropriate protocol, such as cardiac arrest, general patient care, etc., for treating patients who are victims of a drowning. Update 2. The catchment areas have been updated in the trauma field triage criteria. There was an omission in the catchment for yellow mechanism of injury in the trauma field triage criteria protocol. The language for St. Rose Sienna catchment should include the city of Henderson in its entirety. You can see here on the screen the update that was made to St. Rose Sienna's catchment area. Update 3 is the heat-related illness protocol. The following language was added to the heat stroke column of both the adult and pediatric-related illness protocols. Continue cold water immersion if initiated. The following PERL was added to both the adult and pediatric heat-related illness protocols. Cold water immersion is the preferred method of active cooling. Some providers, such as certified athletic trainers and event medical personnel, are prepared to initiate cold water immersion prior to EMS arrival. If cold water immersion was initiated due to documented hyperthermia, these patients should not be removed from cold water immersion prior to their rectal temperature reaching 102.2 degrees Fahrenheit or 39 degrees Celsius, or mental status returning to baseline unless it's required to manage other emergent issues such as the airway. Update 4 is in reference to the adult bradycardia protocol. The dose of atropine has been increased to 1 milligram, and language has been added that reads every 3 to 5 minutes, total max dose 3 milligrams. The PERLs to the adult bradycardia protocol have also been updated. Identifying signs and symptoms of poor perfusion caused by bradycardia are paramount. Treatment should only be given when patient is symptomatic due to bradycardia. Athletes, patients on beta blockers, and young, healthy patients may have a slow resting heart rate at baseline. Do not delay pacing while waiting for IV access. Ensure adequate oxygenation and provide ventilatory support as needed. Consider hyperkalemia in patients with wide complex bradycardia. And atropine is unlikely to be effective and should be avoided in patients who have had a heart transplant. Update 5 is in reference to the pediatric cardiac arrest protocol. The following language has been added to the pediatric cardiac arrest protocol. Early ventilation is recommended. The following language has been added to the PERLs. Once an advanced airway is in place, compressions should be continuous with ventilations every 3 seconds. Update 6 is to the needle decompression protocol. This protocol has been changed to the needle thoracostomy protocol. The primary insertion site has also been changed to the mid-axillary site. This site is going to be between the 4th and 5th intercostal space in what we define as the triangle of safety. The triangle of safety is bordered by the 5th intercostal space, the lateral edge of the pectoris major, and the lateral edge of the latissimus dorsi. Update 7 is to the behavioral emergency protocol. The behavioral emergency protocol now includes the improved Montgomery County Richmond agitation sedation scale. Patients are rated from -5 to 4 depending on their level of mental status and agitation. This is the current behavioral emergency protocol. As you can see, patients are broken down into a scale of 1 or 2 or 3 and 4. Patients who are agitated 1 or 2 should have verbal de-escalation techniques, and they should be evaluated and treat reversible causes. Patients who are severely agitated or considered dangerous fall into the 3 or 4 scale. These patients should be treated with a sedative if available, and restraints should be used. This brings us to the end of the July 2024 protocol update.